If they were not fed this form of astaxanthin, they would end up being a whitish gray color, and that doesn't sell very well in the market. So they do give them the synthetic astaxanthin, which does not have the same properties as natural astaxanthin. It is not as potent an antioxidant, and it also has slightly different structures, so it's absorbed and works differently in the body.
And we're going to talk in a little bit about Fortifeye Focus, a supplement I developed that utilizes lutein, zeaxanthin, and astaxanthin, triple carotenoid therapy. And one reason it's so beneficial is these three carotenoids are really in the eye in different places, aren't they?
Yeah, they are. So they work really well together because they're complementary. Lutein and zeaxanthin works in the back of the eye in the macula and retina, whereas astaxanthin works in the front of the eye in what's known as the ciliary body. And if you'll just give me a second, I can mention the ciliary body is basically made up of muscles and ligaments that control the shape of the lens to adjust focus, as well as the ciliary processes which secrete aqueous humor. And that's an antioxidant-rich liquid that's also full of nutrients that helps to feed and protect the lens and the cornea at the front of the eye.
And we know it works. I mean, I've got probably literally thousands of people taking the supplement Fortifeye Focus now. Me being a testimonial, I'm 56 years old. I can see 0.37 imprint. That's very small. For people out there, that's 20/20 up close without any reading glasses. You never see me in glasses. I see well in the distance. I see well up close. So there's a lot of benefits. We call it Fortifeye Focus because it does improve focusing ability. There's studies that prove it improves focusing ability. Many of my patients have dramatically reduced their eye strain from the computer. And when you think about it, when we add the lutein and the zeaxanthin to it, those carotenoids also increase macular pigment density, so helping to filter the harmful blue light from the digital world we live in. So what could be better? One little pill you take that helps filter the harmful blue light and reduce the accommodative stress from the computer.
Absolutely.
The iPad. The iPhone.
All those digital screens we're exposed to, where the issues when we're exposed to digital screens quite for prolonged periods of time, and we see 65% of Americans reporting symptoms of digital eye strain are both the blue light, but also the fact that you're overworking those ciliary muscles at the front of the eye and they get tired. And astaxanthin helps to improve the endurance of those muscles by basically neutralizing the free radicals that are formed when those muscles are overworked.
Fantastic. We're going to the phones because Bob is on hold. Bob, good morning. Thanks for holding.
Thank you, Dr. Lange. Thank you. I'm going to revisit a question that I had for you last week, as well as another question. Did you get a chance to research the lectin, L-E-C-T-I-N, in tomatoes, in the seeds, and then the skin, and it?
A little bit, not a lot. I remember when I was leaving, I looked into it a little bit, and I was actually discussing with Dr. Hecht earlier before you called because we figured you may be calling and asking that. I remember reading that it is kind of like an internal pesticide for many different foods, beans and legumes and tomatoes, so that fungi and other things can't attack this type of thing and eat it. So it's like an internal pesticide. You know what I think about pesticides? Consuming it, just from the limited bit of research I did, I haven't seen a lot of good studies with humans in it. There's a lot of animal studies out there. And one thing I noticed is it actually can combine or bind to the intestinal walls, causing inflammation in our intestinal walls. So certainly people out there with irritable bowel syndrome and things like that, these lectins may not be the best thing in the world. But I haven't seen a lot of good human studies. I said the internet is filled with all sorts of studies with animals. I'm going to let Dr. Hecht chime in on that.
Yeah, so just to sort of rephrase that, essentially lectins are proteins that bind sugars, and plants use them as the defense mechanism. Of course, they don't work the same way in us when we eat those plants, and there's only a few foods like tomatoes and soybean and peanuts, legumes mostly, but also nightshade related plants that contain higher quantities of these lectins. And one way to neutralize them is if you cook them or sprout them, or fermentation in some cases, like that can help to basically neutralize those lectins, and any problems that you may be experiencing or worried about, that would probably take care of that. However, for tomatoes specifically, there are no human studies that show there's any issue with lectins. There's some animal studies that talk about leaky gut and inflammation in the gut, but nothing in humans, so it's kind of inconclusive.
So cook your tomatoes, because it's hard to sprout.
Well, always do anyhow. Okay, my last question. A couple weeks ago, maybe a month, I asked about a more natural way to control cholesterol, and you suggested niacin. I've been on niacin since that conversation, and unfortunately, my blood work has shown an increase in my cholesterol level. So my question, I guess, is how much niacin does one have to consume for it to have a positive effect on cholesterol?
Yeah, that's a great question. And, the problem with niacin is, and I told you to get the niacin that causes you to actually flush, because the other niacins I don't particularly like, some of those niacins can actually be hard on the liver. And so here's an example of me. I'm light complected, green eyes, blonde hair. We used to have blonde hair anyway. And if I take 50 milligrams or more, I start to flush, and 50 milligrams really won't do anything. I mean, I've seen studies where they take very large amounts of niacin, 1,000 milligrams a day to get the benefits. But, you could have some side effects from that. So remember, cholesterol, it's a whole total package approach. Cardiovascular exercise, weight management, losing weight, getting out in the sunshine. Vitamin D has an impact on cholesterol, believe it or not. The niacin, low saturated fat diet, eating more chicken and turkey and fish and lots of vegetables. Ideally, get in the best shape of life. Coconut water has been shown to bring that down. Fibers have been shown to help that. High fiber diet. So there's a lot of things you can do, and you can really search that on the internet as well. But if your cholesterol is super high, it all depends on the ratio, the HDL and the LDL, and what type of cholesterol, these fluffy ones or these tight, hard little cholesterol particles, but also what your C-reactive protein, your triglycerides and things like that are as well. And the doctor has to look at that and then take all that into consideration. If you're not happy with your doctor prescribing medication for this, then you got to see somebody that's in tune with, holistic natural medicine that's reputable. And, Dr. Podlatsky upstairs at the Lange Eye Institute, I've mentioned him a few times. But there's some other good doctors in Gainesville and Ocala that will approach it naturally as well.
And Bob, actually, astaxanthin does have some effect on cardiovascular health. We do have a few studies that show it does help with blood chemistry by reducing triglycerides and increasing HDL, the good cholesterol, which helps to clear out LDL, the bad cholesterol. So, supplements are supplementary to a good diet and exercise. So those things go together, and one won't help without the other, but it is something else you might want to look at.
Well, after your last appearance on the radio, doctor, I increased my astaxanthin, my Focus, from 1 to 2 a day.
Yeah,
good.
That's great.
But I can't say that's shown any response to my cholesterol levels. But I'm in my 72nd year now, and I suspect these things are starting to creep in on me. I'm still in pretty good shape for somebody my age.
That's good. I'm glad to hear it. And certainly, yes, you're right. So 12 milligrams a day is what we would recommend for cardiovascular. And in addition to blood chemistry, it should also help retain some of the elasticity in your blood vessels to help improve blood flow. So there are a number of ways in which this could help.
So keep taking the 2 Fortifeye Focus, Bob.
Well, I expect to do that. And just a word to say goodbye to you, Dr. Lange. Stay off the wall, all right?
I will. I will not be live next week, so if people have questions, they're going to call this week. I'll be at Sebring and got that new race seat in there, carbon fiber seat, new lithium battery. I'm going to be about 100 pounds lighter in that car, so I'm going to try to get a new record for myself.
There you go. Be careful, Dr. Lange.
Thank you. Take care.
Yes, sir.
All right, 866-977-4820. If anybody has a call, especially regarding carotenoids, lutein, zeaxanthin, astaxanthin, we have one of the leading authorities in the country on the show with me, Dr. Karen Hecht, with Astaril. So give me a call, 1-866-977-4820. You can also watch this video actually probably later on today or probably by Monday anyway. We'll have it up on Ocular Health channel. So on YouTube, you can go to Ocular Health on YouTube and watch it. Or you can watch us right now at News Talk Florida on Facebook. Remember, you can see me at the Lange Eye Institute in the Villages Monday through Thursday. I do take Friday off to prepare for racing usually. And you can learn a lot more about these supplements at fortifeye.com, Fortifeye, fortifeye.com. I'll give you the toll-free number for Fortifeye vitamins because a lot of you out there, believe it or not, do not have internet access. That's why you listen to me. So the phone number for Fortifeye vitamins is 866-503-9746. That's 866-503-9746. You can talk to the crew there. You can order Fortifeye Focus and start reaping the benefits of astaxanthin combined with lutein and zeaxanthin. Remember, Fortifeye Focus is the only supplement in that industry that has both lutein, zeaxanthin, and astaxanthin. All right, we're going back to the phones. Sonny in Ocala, good morning, and thanks for holding.
Good morning, Dr. Lange. Recently moved here from Connecticut, and I was on your website while I was up there. My job was entailed about 12 hours a day on a computer. Two things that I noticed after about a month or so of using the Fortifeye Focus was that the blurriness, which occurred as the day wore on, decreased significantly, which I thought was absolutely great. Also, I had some watering in my eyes, which decreased, and some dryness in my eyes, which decreased. Second thing I noticed was the amount of sleep I was getting. I was a 2 to 4 hour a night sleep person. That was it. And I noticed that on your website, you mentioned that blue light was kind of a type of thing that was a deceptive. It made you think there was sunlight when there really wasn't. So now I'm up to about 8 to 9 hours a night of sleep with the triple carotenoids that you have in the Focus. And my dreams have ceased. Some of them I'm sorry to see go, but we'll leave that to an off-the-air conversation. But in any event, the triple carotenoids coupled with the other benefits of Focus, muscle fatigue. My muscle fatigue has decreased significantly in that. So I wanted to thank you for that. And I wondered if you could expound on some of that.
Well, that's interesting. I obviously you've been doing a little research on this, and you see some of the the benefits of this. So hopefully this hasn't been all the power of suggestion and the placebo effect that you've been getting, which I doubt. Fortifeye Focus, the things that you mentioned, absolutely, it does help eliminate this eye strain and the fatigue, especially working on the computer. And therefore, when you eliminate this fatigue on the computer, the overstress, you don't get this accommodative pseudospasm that causes you to have blurred distance vision. So I have a lot of patients that have better distance vision, better night vision, especially since they're using the Fortifeye Focus, because they're not overstraining and overfocusing their eyes, throwing them into a pseudo-myopic state. So yes, that has benefit. I have many patients that have told me that. I personally have noticed that as well. As far as sleep goes, it's interesting because if we help to block the blue light, I developed a lens called Blue Light Defense. When people wear this lens, they do sleep better. So it does make sense, but I'll let Dr. Hecht chime in a second about all of this. I mean, if we help to filter the harmful blue light, I mean, that in theory may help with sleep and help the pineal gland secrete more melatonin. If melatonin goes up, you do sleep better. You go through REM phase of sleep, but usually you do dream a little bit more if you're going through that phase of sleep. I noticed that I do sleep a lot better, but I do a combination of the Fortifeye Focus and I wear the Blue Light Defense lenses, from about 5 o'clock until I go to bed. And I'm sleeping like a baby these days. And if you listen to this radio show, 4 or 5 years ago, I was the biggest sleep deprived person you'd ever see. At one time, my cortisol levels were off the scale because I was sleeping 1 to 2 hours at night. But also, I had 13 offices I was running, and now I have 1. So maybe a little less stress is helping me sleep as well. I'm going to let Dr. Hecht chime in on this.
Yeah, I think you've really hit on a few areas where we actually have 16 clinical studies that support basically what your testimonial is, which is, decreased temporary blurriness that you get from staring at a computer for a long time, stressing out those ciliary muscles and causing them to spasm, and the muscle fatigue that you mentioned. Those are definitely areas that there are 9 separate studies that show, all of them showing positive effects on accommodative range, and also improving near point of sight as well as far point, and improving the speed of focus, actually, even after a challenge where you challenge the participants in the study to do some near work or digital screen work for a prolonged period of time. So that's great to hear that out, in the field working for you. And the other thing you mentioned was some dryness and or even watering, and that actually is a symptom of the reduced blinking that we do when we're staring at a computer screen, something like 5 times less blinking staring at a digital screen, which does cause, the ocular surface inflammation. And astaxanthin does have some anti-inflammatory properties, so there may be some linkage there, but there are actually no studies directly linking the two. What we do see is that it does improve the antioxidant capacity of the aqueous humor, and there is one study that shows it reduces the reactive oxygen species in tears, which are linked to causing inflammation as well.
And also, Sonny and Dr. Hecht, I see clinically, I probably use more astaxanthin than any doctor in the country, if not the world, on a daily basis in clinical practice at the Lange Institute. And, I used to add something called GLA, gamma-linolic acid, to omega-3 fish oil for my dry eye patients, because there were some limited studies that suggested it may be beneficial. And I'm not doing that anymore because subjectively I didn't have a lot of patients coming back and telling me it was the panacea of perfection they were looking for. So I just kept them on Fortifeye Super Omega. I didn't add the GLA anymore. But a few years back, I started adding Fortifeye Focus to the regimen. And now I discuss this with doctors all over the country, if not all over the world. And we're recommending 2 Fortifeye Super Omega and 1 Fortifeye Focus for patients with dry eye. And we see an additive effect clinically, subjectively, for dry eye patients. Not only do we see objective results improving, tear breakup time improving, staining on the cornea improving, but the big thing is subjectively they're feeling better. Remember, if you have dry eyes, you can also have tired eyes, and those symptomology go hand in hand. If we can relieve both the dry eye symptoms and the fatigue symptoms, it's a win-win situation. So absolutely, I love Fortifeye Focus for patients that are experiencing dry eye. One day we'll do a placebo-controlled study and see if legitimately it is working as well as I think it is.
Yes, doctor, I had one more thing that I needed your advice on. I was there was some glands, and I think it was meibomian glands in my lids, I guess it is, and doctor up in Connecticut recommended something called exfoliation. But I wondered if you treated that at the Lange Institute, and what type of method that you might have to do that.
Great question. Wow. I couldn't have hired you to ask better questions. So anyway, exfoliation. Now, this is something relatively new in the eye care world, in ophthalmology and optometry. And the good thing about combining the omega-3 with the Fortifeye Focus, it does help open up these meibomian glands. Meibomian gland dysfunction is big and very vogue in everybody when they hit 50, 60, 70 years of age, even in younger people. So how do we open up the meibomian glands? Number one, taking the right supplements that have some anti-inflammatory properties like Fortifeye Super Omega and Fortifeye Focus. That's going to help. Number two, we got to clean the eyelids. So cleaning the eyelids with something like a detergent-based lid scrub, kind of like OcuSoft or Oasis, any of these can help scrub the eyelashes. You do lid scrubs at night before you go to bed. But here's the problem. Nobody is as meticulous as they should be scrubbing their eyelids. They don't force it enough because they're afraid it's going to hurt their eye. And these little scales, these things hang on the base of your lash, and they have bacteria in them, or they have Demodex, which is a mite. And these crawl into the hair follicle where the cilia actually on your eyelashes. and they just get impacted in there over time. And then you get this crusty, inflamed eyelid. And so we look at your eye, and you have a grade 4, what we call blepharitis. And lid scrubs just aren't very effective, but until recently, we didn't have anything. So what you were talking about, lid exfoliation, we do that at the Lange Eye Institute. We just started doing it a few months ago. And so there's a few ways to do it. There's an instrument called BlephX, and there's another instrument called Lid Pro. Either one of them are going to work the same. They're both very good. They're very effective. And we use those at the Lange Eye Institute. It's not covered by insurance. We lay you back. It's a relaxed environment. We put some special little cleaners on your lids. You relax. We take this. It's like almost like it sounds like a drill, like, but it's not a drill. It's got a little soft sponge, kind of a medical sponge, if you will, on the end of it. Rotates at whatever, 10,000 megahertz. It sounds like a little two-stroke motorcycle in there. And we actually just debride your eyelid margins with this. And we go back and forth, up and down on the upper lids, on the bottom lids, on the meibomian glands. It's amazing how well it works. I had a patient the other day that has chronic Demodex infestation of his eyelids, and he's been using Clearadex and all sorts of lid scrubs, and nothing has helped. So I spent about 15, 20 minutes debriding or exfoliating his lids, and right after, I mean, within 5 minutes after, he said, my eyes feel better than they felt in, 10 years. They feel like they're breathing, and they weren't red and crusty. And it was so interesting because he was so happy. Most of my patients have my cell phone. He called me the next day, Friday morning, because I did this Thursday, saying that his eye felt great. The swelling around his eye was better. His eyes weren't as dry. So it is a procedure that legitimately works. But like I said, it's a $200 out-of-pocket fee, but it's well worth it.
Well, thank you, both of you, doctors, and I am very interested in that treatment, and the price sounds very reasonable, so I will make an appointment to have that done. I thank you both for your time and your advice, and your product, absolutely amazing, absolutely amazing.
Thanks, Sonny.
Thank you, Sonny.
Wow, we got to hire him. Great questions. And the Lange Eye Institute, the phone number for the Lange Eye Institute is 352-753-4014. One more time, write this down. Lange Eye Institute in the Villages. That's the dead center of the state. 352-753-4014. We have patients that come from all over the country to see us because we do things with a twist. I mean, we approach things medically and surgically, certainly, but nutritionally, we're doing quite a few less injections in the eye for macular degeneration than the national average. Dr. Michael Tolentino is the retina specialist that has space inside the Lange Eye Institute. He was the first to actually inject a drug into the eye for macular degeneration. He's Harvard trained. So we have a great retina department at the Lange Eye Institute. All right, let's go back to the phones. I think first we're going to go Melvin and then Steve. So Melvin in St. Pete, good morning.
Hi, Dr. Lange. Mainly I called. Last week you had a good special. I want to get the protein and the greens,
right? And
I didn't get the code down or what particular one that you had for a 40% off.
Right. Good that you called back. So it's Paleo 40. We're still running that Paleo 40. So PALEO 40, and put that in the promo code on Fortifeye.com. And you got to go to, remember, we got two proteins. We got Fortifeye Naked Super Protein or Paleo Naked Super Protein. It's the same exact formula. I just put a different label on it so we could get retail space at the stores because Fortifeye is only in doctor's offices. So once again, it's the same thing, but I created...
They will know what I need. I mean, I don't have any computer. I have to call
Yeah, call Fortifeye and tell them you want the special, the 40% off special for the paleo protein. Yes, they will know absolutely.
And now does the 40, I need, for the meal replacement, I need a serving of that and a serving of the greens.
Right. The greens is not on that 40%. We don't even mark that one up that much. So the superfood, the Fortifeye Organic Blue Green Superfood is not on that. However, if you buy 3 of them, you can get 20% off on those.
Yeah, I'll do that. I'll buy 3 of the protein and 3 of the greens.
Yep, they'll give you 40% off the protein, then they'll give you 20% off the superfood. And you can call
I've been taking the the one a day. I got a bunch of them when they were on sale.
Right.
And is that still available?
Absolutely. Yeah, we still have.
And if I buy 3, do I get
20%? Always, if you buy 3, you get 20%. And on those special occasions, usually toward the end of the year, is when I run those big specials.
Okay. Well, I can order the one with the. Do I need to tell them a code?
No, you really don't. You don't need to tell them the code. Just tell me, I listen to Dr. Lange all the time, and I want the 20% off when I buy 3, and I get the 40% off. They'll give that to you for the protein. You'll be in good shape.
Okay, and take 1 protein and 1 scoop of the greens for a meal replacement,
right.
And I'll take the 1 a day. I got to order some more of them, and I'll be fine.
All right, Melvin.
Thank you.
Take care. Bye-bye.
Thank you.
We got a lot of great listeners. All right, we're getting ready to take a call with Steve, but first I do want to chime in and talk to Dr. Hecht a little bit more about astaxanthin. Fortifeye Focus, if I recall now, and you should know more about this than me because you're in this industry, is the only supplement with all 3 carotenoids in this industry.
That's right. Actually, it is, which is surprising since it is such a great combination that is a complete carotenoid formula for all of the eye, front and back. So you really have a unique formulation in Fortifeye Focus using both lutein, zeaxanthin, and astaxanthin all in one. And they work very well together. They're not competing for absorption in the gut, so they're all going to get absorbed in the gut, travel through the cardiovascular circulatory system, and get deposited because they're all fat-soluble nutrients. So they all get past that blood-retinal barrier and deposit in different areas of the eye to give you more complete protection and nutrition for your eye.
And I've seen, at dinner last night, I showed you some pictures of cross-sectional images of the retina, something called OCT. And in our retina clinic, we have patients now where we're doubling up on the Fortifeye Focus, having them take 2 a day. And I showed them some pictures of before and after, just 7 weeks apart, of patients that have what we call PEDs, pigmented epithelial detachments, related to drusenoid bodies in the retina. This is the dry form of macular degeneration. And the only thing we did different on these patients, and these patients have been following for years, they're on the same diet, the same medications, everything's the same. We added 2 Fortifeye Focuses, and you saw the difference quite a bit, a significant improvement, less drusen and less of these pigmented epithelial detachments, and also their vision improved. So this is not a double-blind, placebo-controlled study. So is it really the Fortifeye Focus that did it? Was it going to happen with time anyway? All I know, I see it on a daily basis. When we add this specific supplement, patients do improve, not only objectively, but subjectively. And I'm not touting this as a miracle pill, but remember, God made a pretty good body if we give it the right fuel. All right, let's go back to the phones. Steve in Clearwater, thanks for holding.
Yeah, I had one question. Is people have had their gallbladder removed and don't have emulsification potentials, would they get less astaxanthin and lutein in their diet to the tissues? And number 2, is astaxanthin metabolized, or does it just go in as astaxanthin and leaves as astaxanthin, or does it actually go through a metabolic chain? Does it change to other compounds? And is there anything you can do to regenerate used astaxanthin?
Nice. I love your biochemistry questions there. Thank you for those. So first of all, the emulsification question is a really good one. Since astaxanthin is a fat-soluble nutrient, emulsification is important in order to maximize absorption, which is why we always recommend that you take astaxanthin together with a meal that contains some kind of fat in it to encourage, bile secretion to improve emulsification. Some of the emulsification starts in the stomach and then later is completed in the small intestine. We do have actually multiple forms of astaxanthin, some of which are emulsified powdered forms. So those would go really well in a kind of a protein shake, for example. Or you can just add the astaxanthin oil to a protein shake to help improve absorption. Your other question was about how astaxanthin is actually actually modified. So that's one of the differences between natural and synthetic forms. Natural astaxanthin is esterified. And what that means basically is there's just two little molecules attached to the oxygens on the ends of the astaxanthin that helps to emulsify the astaxanthin naturally. And this is how astaxanthin is made in nature. And when it gets absorbed, those are actually removed from the astaxanthin, and astaxanthin gets absorbed in what's known as the free form, which is the form that fits into your membranes in the best possible way. So it fits actually spanning the membrane from end to end, providing more complete protection, but on either side of the membrane as well as inside the membrane, which is unique to astaxanthin and its structure. So those are some of the differences. Did I answer all your questions, or did I miss a third one?
Well, I have suspected, and this is not verified, that I may be a victim of early Alzheimer's disease. If this is true, and I have no reason to believe it is, I mean, I have no verification of it, but I just suspect that I might be getting early Alzheimer's. Could that help the brain?
It's an emerging area for astaxanthin. There are about 4 studies, so astaxanthin does cross the blood-brain barrier as well, which is why we can even talk about cognitive benefits. We've seen some benefits to midterm memory, spatial attention in studies where participants were doing sort of various computer card games and tests. There is one study that looks at participants that had early signs of a kind of dementia, but it was a combination study, so it wasn't astaxanthin alone, where they saw some improvements in clock drawing and word recall. I think it would be good for you to talk to your doctor about this, but generally when we talk about astaxanthin for cognitive benefits, we talk about a 12 milligram a day dose.
Okay. And one more thing, and this is a real quick comment. I've noticed that a lot of night lights, the LED light nights, are blue. And when you wake up in the middle of the night and you look at the night light, does that blow out your melatonin for the rest of the night, or is that just not enough?
Yeah, that's probably not enough, and that's probably not right up in your face the way the computer and the iPad and the iPhone is. But you know what I did, and I sleep better? I put black electrical tape over all those little LED lights in my bedroom, and it has helped me sleep better.
Yeah, I bet you it does. Well, thank you very much, and thank you, Dr. Hecht. You're making a lot of people's lives a lot more pleasant to live, okay?
Well, thank you so much, Steve. I appreciate that. Take care.
Okay.
Thank you for your call.
Bye-bye.
Bye.
All right, you're listening to Ask the Doctors this morning. Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins here with Dr. Kieran Hecht of Astareal. If you got a question, give us a call at 866-977-4820. That's 866-977-4820. We've been talking about astaxanthin and 3 carotenoids that are in Fortifeye Focus, a supplement I developed. You can actually order that from Fortifeye.com, Fortifeye, Fortifeye.com, or call toll-free 866-503-9746. That's 866-503-9746. Also, if you buy 3, you're going to get 20% off. Write this code down, LEC20. Might be LEC 20%. Oh, boy. So 2 LEC20, or actually I think it's LEC 20%. If it, try both ways, it should go through and factor in the 20% off. If not, you can always just call Monday morning and talk to them and have it shipped to you. All right, when I was researching astaxanthin to use as a nutrient in our Fortifeye Focus, I looked at all the companies, and there's a few other companies that do extract astaxanthin from algae. But I determined I wanted the best, and from what the research I did, I picked Fuji, which is the company that owns Astareal and the company that Dr. Hecht works for. And there were some valid reasons why I picked this particular company versus others, and I want Dr. Hecht to expand on why I call Astareal the gold standard of astaxanthin in the world today. Tell them about your manufacturing process, how it's different from just open fields where they're grown, and how it's actually grown in the United States.
Yeah, well, you've touched on our provenance, which is, Fuji is a pharmaceutical company, and so we follow the pharmaceutical type standard when we grow in our manufacturing facility, which is in Moses Lake, Washington. So all of our algae is grown there in the U.S. in fully enclosed indoor photobioreactors, and it's a proprietary method allowing us to HEPA filter the air, which is the same kind of filtration that is used in hospitals. And we have reverse osmosis or triple filtered water, which we use not just for growing the algae, but also for cleaning all of our equipment. The reason that's important is because it provides the cleanest, most controlled environment for growing the algae. And it contrasts to other ways of growing algae, which are mostly outdoor methods. Of course, when you're growing things outdoors, you have a lot less control. You obviously can't filter the air, which leaves you exposed to air pollution and persistent polyaromatic hydrocarbons, some of which have been linked at certain concentrations to being carcinogens. And the other thing is you can't control the weather, right? Sunlight, productivity of the algal growth is affected. And what that means is you have to harvest a little bit earlier sometimes to prevent contamination. And also, because that means that there's going to be some chlorophyll or green left in your algae. And what you really want is to harvest them when they're fully red, have the most astaxanthin content that you can get out of them so that the stability is not affected by the chlorophyll contamination. And we can achieve this in an indoor environment. And that's part of what makes us special. We're also the most studied brand of astaxanthin out there. And we pioneered the market. So we've been at it for 30 years. So we really have a lot of technical expertise and research expertise in this area. We made the scientific foundation that supports astaxanthin as a nutrient.
Fantastic. All right, we're getting ready to take the next call here. 866-977-4820. That's 866-977-4820. And then what also I want to do is touch on some of the other benefits of astaxanthin in a few minutes. I mean, I've noticed many of my patients, especially women, when they take Fortifeye Focus, they notice their skin, the integrity of their skin, the skin health is actually better. And I've got lots of athletes, some world-class athletes, professional athletes that have been doubling up on it that are actually telling me, like marathon runners have better times and they have less muscle fatigue afterwards and faster recovery. And we're going to talk about astaxanthin and muscle health and also skin health in just a minute. But let's go back to the phones. Brian in Newport Richie, good morning.
Good morning.
How are you?
I'm not sure what caused it, but the analogy I can give you is, when your windshield gets foggy and then you turn on your defrosters, then the window clears up. I get that in my right eye. It just comes on randomly, usually afternoon or evening, watching TV or reading, and it just fogs up for, not the whole eye, but part of the vision is foggy. It lasts maybe 20, 30 seconds. As that slowly goes away, as though a defroster is coming on, then when that's clear, I get little shooting stars. I have no pain. Then the shooting stars disappear.
Interesting. So before you said the shooting stars, it sounded like dry eye, something called keratoconjunctivitis sicca, and it still could be that. So what happens is during the day, the eyes start to dehydrate. When they dehydrate, the optics of the eye become very poor, and your vision gets cloudy and foggy. And then you start to blink. You blink, 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 blink a lot, and then the vision comes back, okay? And so if
I don't tend to blink.
Right.
I just sit there and I look out my eye, and I just see it slowly clear up. Like I said, it clears up like the defroster on the windshield.
Right, Brian.
And then as that clears.
How old are you, Brian?
68.
68. And how much do you weigh?
175.
All right, so you're not overweight. And what about blood chemistries? Do you know how your cholesterol, your triglycerides, things like that?
Yeah, everything's in line. I just had a blood test a few months ago.
Do you smoke?
I have no problem.
You smoke?
Yes.
You smoke, okay. So it's probably not a bad idea, Brian, to talk to your primary care physician and have your carotid arteries checked, okay? Because sometimes we can develop a similar presentation, just like you're experiencing with these flashing lights and a little bit of strange vision when the carotid arteries are blocked. Also, if any plaque ever breaks off and lodges in an artery in the optic nerve or the retina, it can have a similar presentation. that very well probably is not it. You can get into your eye doctor, have your eyes dilated, let them know what's going on. They can look at the blood vasculature, the tiny capillaries, the arteries, and the veins in your eye to see if there's any potential plaque that's actually building up in those blood vessels. That will be a telltale sign of this happening. But also having the carotid arteries checked, a good cardiologist probably checking the heart. It's probably not a bad idea. There's a whole host of things that can cause this. Atypical ocular migraines can cause a very similar presentation, but they usually last anywhere from 5 to 20 minutes, a little longer than just a few seconds. So it could be an atypical ocular migraine. It could be dry eye, believe it or not, and then vitreal tension that's causing these flashing lights. Probably not. It just doesn't sound like that type of presentation. So my recommendation, first of all, get your eyes dilated, have it looked at very carefully, then set up an appointment and talk to your primary care physician about ultrasound of your carotids and potentially, a cardiologist.
Okay, I went to a cardiologist last September, and I had a nuclear stress test, and I came out with flying colors. He said, I did great. I don't have high blood pressure.
Good. And the other thing I'm not going to harp on because I'm sure all your doctors do, and you know what I'm getting ready to say.
Smoking, yeah, absolutely.
is stop smoking or cut back because smoking lowers your serum antioxidant levels in your blood. It prematurely ages you. It clogs your arteries, increases your risk of every single health problem. To this day, I haven't found smoking helping anything yet.
Obviously.
All right.
Thank you very much.
All right. Take care. Bye-bye.
Bye.
All right. Let's go back to the phones. Let's see. Nelson, Crystal River. Good morning. Hello, Nelson. Nelson. Testing 1, 2, 3. Let me try it again. Nelson. Put him back on hold. Maybe I got to him too quickly. Let's see. All right, 1-866-977-4820, 1-866-977-4820. You're listening to Dr. Michael Lange and Dr. Kieran Hecht. Let's talk briefly about skin health and astaxanthin.
Yeah, absolutely. So we touched sort of earlier on two other benefits of astaxanthin, skin health and muscle health. So we can go over skin health first. Essentially, this is the largest organ in our body. It is constantly exposed to the environment. And that means UV-induced reactive oxygen species, which cause inflammation, which cause a degradation of the collagen and elastin networks in that deeper layer of skin. So you can take astaxanthin orally with Fortifeye Focus, and at 6 milligrams a day, we've seen improvement in hydration and elasticity. And there's some evidence of reduced wrinkles or fine lines as well. And that's because you're actually protecting that protein layer in the deeper layers of skin from being broken down or degraded by free radicals, which are formed when you're stressing out your skin. And this can be seasonal change, low humidity, or exposure to the sun. So we've definitely seen benefits in that area. When it comes to muscle, you can understand the function already by what we've spoken of in terms of the eye and the ciliary muscles. So the muscle in the eye, it requires a lot of energy to focus. Anywhere closer than 20 feet, that muscle contracts and is working hard. And where it's getting that energy is from the mitochondria in those muscles. Muscles are very rich in mitochondria because they demand a lot of energy. And astaxanthin is a mitochondrial nutrient. So it actually targets the mitochondria, deposits in the mitochondrial membranes. And the reason that's great is because mitochondria, when they're producing energy, are also producing free radicals as a byproduct of that energy production mechanism. So astaxanthin is poised in the mitochondria to neutralize those free radicals and preserve mitochondrial function. So you're getting more efficient energy production. And that's why you talked about some marathon runners who can benefit from this. And that's part of the reason we're neutralizing free radicals during exercise, which helps improve endurance.
Fantastic. Yes, lots of my patients that are taking it. I got a lot of people taking Fortifeye Focus. They're noticing improved skin health, and the athletes are noticing, benefit from that aspect of improved recuperation. That's hard to say. Recovery. They're just not as sore after working out, but also more stamina, more endurance.
Yep.
And so most of my athletes are taking 2 a day, and I usually recommend they combine that with our Fortifeye Super Protein, which is a non-denatured whey protein concentrate, and combine the two pre-workout, and they can combine it post-workout.
Yeah, actually, I'm glad you mentioned the post-workout, because that's what I find the most useful, beneficial for me personally, is that there's a second wave of free radicals that forms after exercise when those muscles are torn up and the white blood cells come in, producing tons of activity and free radicals to help repair the damaged muscle. And that's what causes that second day soreness or delayed onset muscle soreness. And astaxanthin is there still after exercise to neutralize those free radicals and reduce exercise induced inflammation via that free radical mechanism. So definitely the soreness is alleviated, and I find that I can recover and come back to my exercise routine a lot sooner this way.
Beautiful thing, astaxanthin. We're going to try to take some calls really quickly here. Let's go back to Nelson. Nelson in Crystal River, good morning.
Good morning, Dr. Lange. How are you?
Fantastic. How you doing?
Doing great. My question is, you had diagnosed me with an epiretinal membrane or macular pucker. Does the Focus have any effect in that regard?
Well, that's a great question. Macular pucker, epiretinal membrane, cellophane maculopathy is all really virtually the same thing. Means you have a little tension in your macular region and it actually wrinkles the retina. I recommend everybody taking Fortifeye Focus that has this. I repeat, there is no studies out there that prove it's going to benefit you. However, it does benefit macular health. I mean, there's studies out there that prove that it improves macular pigment density. So this is a macular problem. It makes sense that it potentially could, who knows, help thwart off some of the negative aspects of an epiretinal membrane. We think that it can help fight against macular degeneration now, based on the studies we're involved in, and some national and international studies that are out there, based on the lutein and the zeaxanthin that's in it. But also, remember, astaxanthin improves circulation to the eye. So let's put it this way: it can't hurt, Nelson. It's only going to benefit you getting those nutrients, or eat plenty of wild Alaskan salmon, organic kale, organic spinach, orange bell peppers, and goji berries. Then you're going to get that combination. But let's face it, you're not going to eat that every day. So I call it an insurance policy. Once again, it's not a miracle pill, but it has so many other health benefits. And since you do have these epiretinal membranes and they do affect your macula, I think it's worth taking.
Well, thank you very much. I use 2 a day of the Focus.
Beautiful. Keep on keeping on.
Thank you, Dr. Lange.
Take care, Nelson. All right, let's go back to the phone. I don't know if we have much time. Nope, I don't think we got a lot of people on hold. We don't have enough time to take those calls. We're going to have you back for another show
Always
soon.
happy to be back.
And so it's interesting, astaxanthin has a culmination of many, many benefits, not only for the eye, but also for the skin, for the muscles. So it is something that if we, that's why astaxanthin found in food, wild Alaskan salmon is really a power food, but we just don't eat enough of it. So anyway, we're going to plan on having you back as a guest very soon. I want to thank Dr. Karen Hecht for being a guest and Aster Real for being a guest on Ask the Doctor. With that, we're out of here. Have a great day, and God bless you.
For having learned how not to cry.